Hi everyone, my name is Gia and I will be doing my presentation on dengue. So, what is dengue? Dengue, also known as dengue fever, is a mosquito borne viral illness caused by the dengue virus, which belongs to the Flaviviridae family. It commonly occurs in tropical and subtropical regions and is transmitted primarily by Aedes aegypti mosquitoes. Signs and symptoms of dengue include a sudden high fever up to 104 degrees, severe headache, pain behind the eyes, joint, muscle, and bone, which gives dengue fever the nickname of breakbone fever because it can feel like your bones are actually breaking when they're not. Other symptoms include rash, mild bleeding of the nose or gums, and nausea and vomiting. According to the CDC, symptoms usually start appearing 4 to 10 days after the initial mosquito bite and can last up to 7 days. In severe cases of dengue, a different kind of fever known as dengue hemorrhagic fever, DHF, can cause skin hemorrhages and lead to organ damage or organ failure. An overreaction to the dengue virus from the immune system can cause dengue shock syndrome, DSS, which is characterized by a sudden drop in blood pressure due to cardiovascular permeability and fluid leakage, leading to potential death if not treated immediately. So, the causative agent of dengue fever is the dengue virus, abbreviated as DENF. This virus is a single stranded positive sense RNA virus, meaning its genetic material is RNA, and once it gets inside the body's cells, it can start making copies of itself right away. So, the four serotypes of dengue is dengue 1, 2, 3, and 4, or D and V 1, 2, 3, or 4. Each serotype is antigenetically different, which means that infection of one serotype can provide lifelong immunity for that one serotype only, but not against the others. So, if a person becomes infected with a second different serotype later on, the risk of developing severe dengue increases due to a phenomenon called antibody dependent enhancement, which I'll explain more in the pathogenic slide. The virus belongs to the Flaviviridae family and is the Flavivirus genus, which includes other mosquito-borne viruses such as Zika, yellow fever, and West Nile virus. It is an enveloped virus, meaning it has a lipid bilayer derived from the host cell membrane, and its structure is icosahedral, which refers to the shape of its protein capsid, and it can be described as a ball made up of triangle-shaped pieces. Inside the host, the virus primarily targets monocytes, macrophages, and dendritic cells, where it uses the host's RNA to replicate itself. And it enters these cells through receptor-mediated endocytosis, and it's a process facilitated by interaction between the viral envelope protein and specific host cell surface receptors. It's important to understand the structure and classification of the dengue virus because it helps explain why it's able to evade immune responses and why it's challenging to develop effective vaccines that can provide immunity for all four serotypes. So, moving on to the pathogenesis and the virulence factors. The pathogenesis of dengue begins with an infected Aedes aegypti mosquito, where it introduces the virus into the skin during feeding. The virus initially infects dendritic cells near the site of the bite, and it undergoes replication before being transported to the lymph nodes and entering the bloodstream. The dengue virus primarily targets monocytes, macrophages, and other antigen-presenting cells, and it enters these cells through receptor-mediated endocytosis, where it exploits surface receptors. And after internalization, the virus releases its RNA genome into the cytoplasm, and it begins replication using the host ribosomes. An important virulence factor of DE and V is the NS1. The NS1 protein is secreted from infected cells, and it plays a key role in immune system evasion. It interferes with the complement activation system of the immune system, and that's how it escapes detection. More importantly, though, NS1 contributes directly to the vascular leakage. It disrupts the tight junctions between endothelial cells, and the leakage is a crucial cause of severe dengue, leading to dengue shock syndrome. And another important mechanism to note is the antibody dependent enhancement, or ADE. So, during a secondary infection with a different serotype, pre existing antibodies bind to the virus and facilitate the uptake in the host cells. And this can lead to increased viral replication and a heightened immune response, which can worsen the symptoms and outcomes and lead to severe dengue or dengue hemorrhagic fever. So, to conclude, the pathogenesis of dengue involves the complex interworkings between the viral replication, immune evasion, and immune enhancement, which can contribute overall to the severity of the disease. So, dengue virus is transmitted primarily through the bite of infected female Aedes aegypti mosquitoes, which are active during the daytime. These mosquitoes acquire the virus when they feed on the blood of an infected individual, and after an incubation period of about 8 to 12 days in the mosquito, they can transmit the virus to other humans. The virus is also occasionally transmitted by a different type of mosquito called the Aedes albopictus, especially in more temperate regions. From an epidemiological standpoint, dengue is a global public health threat. According to the World Health Organization, dengue affects over 100 countries, particularly in tropical and subtropical regions such as Southeast Asia, the Pacific Islands, the Caribbean, and Latin America. Each year, there are an estimated 390 million dengue infections, of which approximately 96 million are clinically apparent. The populations most affected include people living in urban and semi-urban areas where there's stagnant water and high human population densities. Those are ideal breeding conditions for mosquitoes. And while all age groups are at risk, children and adolescents are especially vulnerable to severe dengue. This disease burden has also increased due to factors such as climate change, globalization, urbanization, and poor vector control programs. So, to diagnose dengue, it involves clinical suspicion and labs, particularly during outbreaks or in endemic regions. In the early phases of infection, typically within the first 5 days, reverse transcription polymerase chain reaction, or RT-PCR, is used to detect viral RNA in blood samples. This method is highly specific and allows for serotype identification. And another early diagnostic tool is the NS1 antigen test, which detects the non-structural protein 1 of the dengue virus. NS1 is present in high concentrations during the acute phase, and it can be used as a rapid identification diagnostic test. After about 5 days post-symptom onset, serological tests become more useful. These include enzyme-linked immunoabsorbent assays, ELISA, that detect IgM and IgG antibodies against D and B. Other supporting tests include a complete blood count, the CBC, which often reveals leukopenia, thrombocytopenia, and sometimes elevated hematocrit, including plasma leakage, is what they indicate. In some labs, the hemagglutination inhibition test may be used for epidemiological studies or to determine the infecting serotype, but it's not routinely used in clinical diagnoses. As for prevention and treatment, there is currently no specific antiviral treatment available for dengue. Management is primarily supportive, with the main goal being the prevention of complications such as shock and hemorrhage. So the treatment for mild causes or mild cases include acetaminophen to manage fever and pain. NSAIDs such as ibuprofen and aspirin are avoided because they can cause bleeding and increase the risk of bleeding. Oral rehydration therapy is essential to prevent dehydration, especially in patients with a fever. And then for more severe cases, intravenous or IV fluid therapy is administered to manage plasma leakage and prevent dengue shock syndrome. Some patients may require hospitalization for close monitoring of vital signs, hematocrit levels, and platelet counts. As for prevention, the primary strategy is vector control, such as eliminating mosquito breeding sites, such as standing water, using insect repellents, wearing long-sleeved clothing, and using mosquito nets, and employing window screens and indoor insecticides. A vaccine dengue vaccine is approved in some countries for individuals aged 9 to 45 years who have confirmed prior dengue infection and live in endemic areas. However, it's not recommended for those without prior exposure due to the risk of more severe disease upon later infection. And this is my reference slide. Thank you so much for listening to my presentation. I hope you guys learned more about dengue.